Whether you're trying injectables for the first time or making a change to a new provider, the more you can learn about who your injector is before you're in the chair, the better that appointment will be. You're listening to Meet the Injector. Welcome back to Meet the Injector. My guest today is Julie Thorne. She's a nurse injector. In what town are you in, Julie? Tell me where you are.
We are in Canton and Milton, Georgia. They're very close proximity to one another.
And are those like Atlanta area?
Yes, about an hour north of Atlanta, outside the suburbs of Atlanta.
How did you land there?
So we actually moved from Orlando. We started our journey. I grew up in South Florida. We moved to Orlando, and we followed my husband's parents here and just fell in love with North Georgia. We're right at the cusp of the mountains. There's so much to do here. We just fell in love with it, and it's been a great place to raise our family.
And did you get into aesthetics before you moved, or when you were still in Florida, or after?
Nope, after. So I actually got my start in aesthetics through my path of regenerative medicine. I worked in the regenerative space for about 8 years, and it just transformed into aesthetics. And I have been doing it ever since, and I absolutely love it.
That's actually a pretty rare path to follow, because regenerative medicine is so new.
Yes.
Is there anything that you've brought with you from that experience into what you're doing now?
I think a lot of the regenerative is now coming into aesthetics. I did a lot of orthopedic work in the regenerative space, and now it's transformed into aesthetics, which has been awesome because I have so much knowledge in the collagen and restoration and natural ways to do things that I think it has helped me tremendously kind of guide my patients as aesthetics takes the turn into that regenerative space. People want to look natural. They want to stimulate their body's own collagen. And it's been amazing to see what has come even into the aesthetic space, even since I've been doing it in the last 5 to 6 years in aesthetics. It's been awesome.
What's one example that is maybe relatable that we could hang on to there?
So think about how I actually very first got introduced to doing anything in the face was the PRP facials with microneedling. That was my first kind of dipping my toe into aesthetics, probably like 8 to 9 years ago. And that was kind of new even then. And don't ask me who decided we should draw blood, spin it down, and put it on our face, and it gives these amazing results. But who knew? Here we are doing it and loving it. So even since I've started, PRP, it's not extinct yet, but it's kind of going to the wayside, and it's being replaced with products like platelet-derived growth factor that we're able to concentrate, get a pure, potent sample that's sterile. We know exactly what we're getting in it. So that's been really helpful, and probably one of my most exciting products that I've used in the last few years that has come to the market and just had amazing results.
What other kinds of things do you do every day?
So we do injectables, so Botox, hyaluronic acid fillers, a lot of lasers. There's not so much laser season, but in the fall, winter, and early spring months here in Georgia, it's pretty hot. So laser season tends to be the end and beginning of the year. A lot of microneedling, and it's very fascinating how all of these things kind of work together. People are like, what do you like to do the best? And I'm like, I like to do all of them because you kind of need to do all of them to give a full complementary assessment and a full game plan for a patient to do to make their skin healthy and natural looking.
One thing that I think historically has been hard to find is someone who can actually synthesize all those things and then look at your face and say, here's what I think we should do. And it's not just one thing.
So one of the things we really pride ourselves on doing here is calendarizing out your treatment plan. It's easy to be like, oh my gosh, you need this and this and this. And, a lot of patients just get overwhelmed. They're like, I just want to try Botox and see if I like it. But if you really can think about, doing Botox for maybe wrinkle reduction, maybe you need fillers for facial balancing. Maybe you need, you still have to take care of your skin. Either one of those are skincare. So you still need something that's going to stimulate collagen. And my kind of rule of thumb is do something healthy for your skin once a quarter. Like that way it's not so overwhelming. Like something, a peel, microneedling, laser, something that's going to help your skin quality and integrity in addition to a great home regimen.
Your calendar planning is actually pretty rare. And I
Oh, really?
appreciate
We
oh
love
yeah.
it.
Yeah. And I imagine that sets you and your team apart a little bit because, not everybody thinks like that. You guys think it's normal. It's really special.
Yeah, well, I'm glad to hear that. We've spent a lot of time. We joke that we're on like version 200 of our little roadmap, we call it. So when a patient comes in, they get a full facial consultation, and we do this thing called a roadmap. So they can expect to come in and kind of fill out a cosmetic interest questionnaire, which just gives us a highlight of what is most important to them. I can look at a face and think like, oh, they need this, and maybe they're like, I look in the mirror and never thought that that was a problem. So I really try to pride myself on focusing on what the patient's goals are first. I'm always happy to lend recommendations if I see something and they're interested in hearing that. But, I also respect the fact that people want to come in and pay for something that they see as a problem that bothers them, and it may not be something that would bother me, but if it bothers them, we should absolutely start there.
I call this the wish list
Yes,
because
exactly.
everybody has one, and you have no idea what order somebody's wish list
Absolutely.
is in.
Yes, and yours and mine might be completely different, even looking at the same person's face.
Yeah, that's well said. Um, maybe this might be a question you don't like or don't want to answer, and if that's the case, then we will skip it.
Okay.
But often I think what sets people apart, along with things like planning and synthesizing treatments, is knowing what to do when something doesn't go the way it's planned.
Oh my gosh, absolutely. So recently, I can share a little tidbit of an experience we had where we actually help manage complications for other injectors. They'll call us, and we have a lot of technology in the office, like ultrasound capabilities. The most common, like really adverse event that might happen, it's very, very rare. But things can go wrong and things can happen, and it's not scary if you're in the hands of somebody who knows what to do. Most everything is pretty fixable. It's just knowing what to do and having the right equipment and resources and a game plan in place when things do go wrong. So we do serve as a complication center because we do have ultrasounds at both of our locations. All of our providers are trained in it. And that's one of the things, is knowing how to manage a complication. I'm a very much against the Botox parties in the people's backyards. I know people love those, and the hair salons and things like that. And I'm certainly not knocking those business models. But, just make sure you have somewhere to go to follow up that has the resources, that has the technology to handle a complication if it arises. It's more important than basically anything that will take precedence over convenience or, oh, it's fun, my friend's throwing it. Like, super, you guys come throw a party at the office where I have everything here in the environment that I can handle anything that goes wrong.
The place you work is pretty unique, and it started actually in a barn. Do you want to tell that story briefly?
Oh, yes. So Dr. Amy and I, we had been longtime friends. Our boys grew up together. So, we both were injectors and had knowledge in this space. And we kind of started on accident. We didn't ever really want to run a business. Some days we still don't want to run a business, but
Mhm.
we, we basically were like, hey, wouldn't it be great if we could start our own account? Like, it'd be awesome if we could just buy our own stuff and inject each other, right? And so they were like, perfect, send us pictures of your storefront to set up your account. And we were like, oh, well, we don't really have a storefront, but Amazon and Hobby Lobby can create you anything in about 24 hours. So we kind of stole a room off of her husband's racquetball barn, which was affectionately known as the Blue Ball Barn by her three teenage boys, because of course, because racquetballs are blue. That's the reason why. Never mind three teenage boys. And so we actually were like, oh, great, we'll call it the Botox Barn. Well, I mean, you can't call something a trademark name. I mean, we know that. We were kind of joking. So in 5 minutes, we decided we were going to call it the Beauty Barn. And this crazy business was born. We literally started in this racquetball like room, a very small little space, which was pretty cool. Um, and we were able to grow that business only by word of mouth. We literally hired a marketer about a year and a half ago. So, and this started in December of 2020. So, I mean, really grew by word of mouth. And then we kind of had a crazy story of growing we built out the garage, then we built a bigger barn. Then we had some zoning issues and had to move. And then we opened a second location in Milton. And now we're back in the original barn that we built. So it's been a very fun and eclectic ride of our beauty barn experience, but I wouldn't have it any other way. We've learned so many things and met so many amazing people along the way. It's been actually an awesome gift.
Have you ever been able to pinpoint what drove all that growth and that I mean, really, I hear enthusiasm.
Oh yes, we're very enthusiastic here. All of us are like this.
That's great. What caused it? Like, what drove that forward for you?
So, I've spent a lot of time, like I've worked in the insurance side of things. I've had a very eclectic nurse practitioner, doctorate of nursing practice kind of background and growth. So I think one of the things when we were like, if we're gonna do this, like we're gonna do it how we want. Like we don't want it to be about money. We don't want it to be like we have always made it about the patient and just being kind to people. And always, always, always our biggest mantra is just doing right by people. And when we first started, we were like, you know what, this is going to be our way to give back to our community in the way of growth, in the way of donations, in the way of, supporting different sports and clubs and groups. And, I think inherently just being nice and taking out her and I have both have worked for places where everything is about bottom line. Like you can't do this if it doesn't promote the bottom line. And we were like, if we're doing a business, we are not abiding by that. And, it's worked out. Obviously, now we have a couple barns and a lot of staff. So, of course, you have to pay the bills and you have to give people paychecks. But, it's just done right by us by just being authentic, genuine people and really sticking to it, always doing right by the patient, being kind to them, and treating everyone like friends and family. I mean, I know other businesses say that, but we truly, truly adopt that as our mantra here.
I don't know how you could take yourselves too seriously when you work in a barn. Like,
Seriously. Oh, I have to tell you though, we did have a lady call once and ask if she was gonna be near the horses in the barn because she was allergic. True story, and it was a serious question.
that is literal.
Oh, it was literal. She's like, I was just wondering like how close proximity the horses are because I'm very allergic to horses. So if they're gonna be nearby, I'm not gonna be able to come to my appointment. And
Did
the
you take
girls
that
were
call?
no, the girls literally put her on hold and they're like, Julie, I think she's serious. And I'm like, please, I have got to talk to this woman. And she was genuinely concerned that she was going to have allergic reaction because we were in a beauty barn. It was hilarious. And it's one of my favorite phone call stories ever.
If she had had an allergic reaction, you'd have been able to handle that too.
True. That's true.
Yeah. Wow. Okay. So, um, you mentioned earlier that you're a trainer, is that right?
Yes, for Allergan Medical Institute, which is the makers of Botox and cosmetic and Juvederm collection of fillers. So this has been a recent thing, and let me tell you, it is a very long process to become one. I've spent over a year in countless interviews. They come and shadow you. You meet with no short of a dozen people to get to this role. They do a phenomenal job in handpicking the trainers, so I do applaud them on that, but good Lord, it has been a process and a fun one, but it's interesting to see kind of behind the scenes. Like, we've always had trainers come to the barn and we're like, oh, perfect. Like Allergan's sending us an Allergan Medical Institute trainer. That's amazing. And it's so fascinating to actually learn all that they go through before you even get like released to train. It's amazing.
Was there anything that really surprised you about learning the process?
Just that they really have their act together. I learned on a call last night, constant education, constantly supporting with new resources and making sure that, you have everything at your fingertips to be able to teach and instruct and mentor. And I learned last night that Allergan hosts about 40,000 trainings a year, and the next closest competing company hosts about 4,000, which I was like, holy cow, that's a pretty impressive number. So I'm so proud to be part of a team and a company that prides themselves on patient safety. That is one of their hallmark pillars is patient safety, knowing what to do in any situation, and really mentoring injectors in the space.
So when you're training, are you going out to other practices and
Yes.
working with people? Yeah.
Yes. So we go for the AMI training, we actually go on site to their office. And it's usually a 4 6 hour like small group hands-on training. We also have our own training academy. It's called Lilac. It is for more advanced training and for things that maybe they can't get in those small group things. We offer a mentorship program where they can come in and mentor with one of our injectors here at the Beauty Barn. And it's been a fascinating road, and it's something that we learned as we brought on new injectors and trained them up, just how little training was available out there for them. So we just kind of organically grew this because we were like, oh my gosh, like people just need this. And the better we elevate and support the injectors in the industry, the better the industry is, because you get people out there that are, delivering not so amazing results. It affects everybody. With the advent of social media, like one bad result can get, a million posts or a million
Mm-hmm.
likes, and, it hurts the industry. So, people ask me all the time, they're like, don't you feel like you're like training the competition? Because most of my trainings are local within a 20-mile radius of our clinic. And we just don't feel like that here. Like we actually feel like supporting and elevating the industry is way more important than someone maybe choosing to go to that spa over this spa. Like there's plenty of faces out there that are looking to be refreshed, rejuvenated, and look less tired, that we can fill up all the med spas in the Atlanta area with no problem.
I really like how you're thinking about it. And I wonder how you and your team have thought about loyalty, because that's really what it comes down to is if you're valuing the people who are coming to see you right now, they're going to refer their friends and their family. They're going to come back over and over again. And I have a gripe where I usually go, which is that I've been going there for a decade. They're my friends. They have never done anything to reward my loyalty for any reason.
So we launched a reward program. It piggybacked. Allergan launched a reward program last September, and then they had some speed bumps getting it rolled out completely. So they kind of retracted it in January, and the Beauty Barn adopted to keep it. We thought it was actually truly patient centric and truly rewarded the patient for brand loyalty. So we kept it at the Beauty Barn, and patients have loved it. So it allows them to utilize their Alley points to earn additional like actual free products. And I tell my patients, like, this isn't girl math, because in aesthetics we are all very good at justifying girl math, but this is like actual good math. You actually get, free Botox, free filler, and those come with, price values, $600, $700. So the loyalty program that we've had success with in the last 6 months has really been amazing, and patients are so excited. Like kind of like you, they're like, "Oh my god, I've been getting Botox for 15 years. Like I've never had anybody give me free Botox. I've never had anybody give me free filler." So it's been really fun to see. We call it like the surprise and delight face. Like we're like, "Guess what today is? It's free Thursday," and they're like, "Yeah." Like they're so
Like
stoked
the whole
about it.
treatment is free?
Up to 50 units.
That's for a lot of people, that's a whole treatment.
Yeah, it can be up to a whole treatment. Yeah, yeah. So it's been a really great. And again, it just goes back to doing right by the patient. Like they are coming in every 4 months and getting their Botox with us. They are buying skincare products. They are doing cool sculpting. They are doing facials. And all those things are. They have plenty of choices to go elsewhere to do all of those services. So the fact that they're picking us and trusting in us,
Mhm.
and some people are driving across town, passing
Yeah.
probably 50 med spas to come here. So that's really special. And we feel very honored to be able to, provide those rewards to them, because not a lot of places do it. Like you said, you've been going somewhere, and I'm sure they haven't said, "Hey, you want a 50 unit Botox treatment for free today?"
No. Well, the reality is they probably wanna do it, but it's always been so hard to do,
Yes,
and you have so many other things to do that it just falls by the way, and it's not like they're over there saying, "We're not gonna reward our patients
of
for coming
course.
back."
Yes. And I mean, I feel
Yeah.
their pain, and especially like in our like earlier, younger days, like it's hard. Like we were busting our butts working, we were working our regular day jobs, seeing patients at night. Like the thought back then of being like, okay, we're going to give you 50 units away for free, like would have been like, I don't think we can do it. So, I understand from the perspective of, being a small business provider, like you do still have to keep the lights on. So we feel very honored, like we've gotten to the point of being able to provide that reward to patients and make it work. And it really has been amazing to see the look on their faces when they are able to redeem it.
Love it. You guys, it's clear that you know what your priorities are,
Yes,
which is
I mean, patience.
people.
Yes,
Yeah.
it's people. It's a relationship with people.
Yeah.
It's doing right by people. It's making, listening to what they want and, hopefully delivering their exact desired outcome.
Let's pivot a little bit and let's talk about Julie outside the office.
Okay.
What do you like to do? Where do you spend your time when you're not working? The
So
little amount of time
the
that
very
probably
little amount of time that happens, we love to camp. We have a camper, and you will find us every holiday weekend in the camper we call it our rented lakefront property because you can get a campsite for like, $30 a night. So we take our camper to the lake. We love boating. We have 2 kids, so now you can add to our regimen. We're about 6 weeks from being complete empty nesters. So my son is in the Air Force in Seattle, so I've already gone to visit him a couple times. And my daughter is going to flight school in San Diego. So both of them are moving to the opposite side of the country. So you can add to my list of hobbies. We'll be traversing across the country to visit them.
and 2 really good places to visit too.
Yes, good places to
Yeah.
visit. Exactly.
Okay. Is there anything you want to tell us that we have not covered?
Just that, anybody who's thinking about doing aesthetics, it sometimes is scary for people who don't really know what to expect. Find an injector, go to consult to a couple places, find an injector that really hears you, that listens to you. Don't hesitate to ask what products they're using. Don't hesitate to ask, what are their credentials? Like, find out what their expertise is. Don't hesitate to ask, what would you do if a complication arose? What's your policy for fixing things? I just encourage people to be empowered and be able to go into a place. And we are honored if you ask us that, because then we get to brag about like all of our cool training we've been to and all of our cool trinkets that we have to help us, be the best injectors that we can be. So I just encourage anybody who may be on the fence, like go to a consultation, ask the questions, make sure it's someone you feel comfortable with, and dip your toe in. Like I promise you, you will not look back and regret it. There's a lot of fear mongering out there. Social media, tends to easily you can get down a rabbit hole of like bad outcomes or things that those are very rare. And if you're seeing an injector that is competent and knows what they're doing, they can explain a lot of those outcomes. And a lot of the pictures you see of people with distorted looking faces, everybody's the number one reason people don't actually get injected or try injectables is the fear of looking unnatural. And, for the most part, you are our billboard. Like I tell people all the time, I also don't want you looking scary. You are my masterpiece that I'm sending out as a walking billboard. So trust me, I also don't want you to look unnatural. So really just go in with that expectation of, telling the injector that that's what you want. And if they're comfortable delivering that and you're comfortable with them, take the plunge. You're not going to look back and regret it. Aesthetics is such a fun industry and such a fun space to be in.
There's nothing like the first time too.
I know.
Like, just the best. I wish I could go back and do it over and over. It was so good.
Your biggest wow result is the first time you do Botox. So the
I'm
first time you do
driving
your
home
laser.
with the rear view mirror on my face the whole time. Like, wow.
That's awesome.
Where can we find you online? Follow you? Where should we look for you?
Yeah, so on Instagram, it's at julie.thorne.fnp, like family nurse practitioner. And then you can also follow the Beauty Barn at TBB Med Spa. And we hope that, you guys come and visit us and visit our page and, like what you see and get a good feel for who we are and what we're all about here.
And if I'm an injector and I'm interested in training, is it the same or somewhere else?
So I do have a website for injectors. It's called trainwithdrjulie.com. That you can visit there and drop me a line in that, and I'm happy to go over some options and things like that that's available through Lilac and then also through Allergan Medical Institute.
Wonderful. Thank you, Julie.
Oh, thank you so much. This was so fun.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering an appointment with this provider, be sure you let them know you heard them on the Meet the Injector podcast. Check the show notes for links, including the Injector's website and Instagram to learn more. Are you an aesthetic injector or do you know one? You can be a guest on Meet the Injector. Book your free recording session at meettheinjector.com. Meet the Injector is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.